There are millions and millions of people suffering from tinnitus right now. Ringing, high-pitched sounds, buzzing, humming, crickets. The list goes on and on. And if you're one of them, I want you to stay with me because what I'm about to share with you today could change everything. I'm Dr. Alan Mandell, and today on your Health Circle, I'm going to give you some alternative techniques, both physical and nutritional, that can help relieve your tinnitus. And I'm talking about methods you can start using right now in the comfort of your own home. Now, before we dive in, let me quickly explain what's actually happening. Tinnitus can come from several places. It might be your eustachian tubes, those little passages behind your nasal area that lead to your middle ear. It could be something as simple as packed earwax in your external ear, or it might be coming from problems in your inner ear, affecting those delicate hair cells from loud noises, ototoxic substances, or medications that have side effects impacting those inner ear cells. Here's what you need to understand. Those inner ear cells vibrate when sound comes through. The sound travels from your external ear to your middle ear, then makes its way to the inner ear cells. This creates electrical energy that travels through the auditory nerve to the auditory cortex of your brain. That's how you hear. But when those hair cells aren't functioning correctly, your brain expects a certain type of electrical signal. And when that signal isn't coming through properly, your brain turns itself up a little bit higher. It's kind of like a radio that you're trying to tune into a song and it's not getting through, so you turn up the volume. That hissing or that sound you're hearing is actually a change in communication between your internal ear and your brain. Now, we can forget about all the technical stuff because here's what really matters. What can we do about it? And that's exactly what I'm going to show you right now. Listen, it's quite common that when you have sinus congestion, those eustachian tubes get clogged. And sometimes just opening your mouth wide, or yawning, or chewing gum can help. You can even hold your nose and make small little puffs with your lips sealed. You might hear a little popping sound, and that opens up the eustachian tubes so it can drain. If those eustachian tubes are affected, it affects the pressure to your middle ear, which affects the transmission of sound to your inner ear, and that can definitely affect your tinnitus. Also, wax being clogged up in your outer ear can potentially lead to problems, as well as infections of the eardrum and inner ear issues. So the first thing I want you to try, and I love doing this myself, is a little Valsalva maneuver. Just pinch your nose and make little puffs like this. You'll hear little noises in there, and sometimes that can drain those eustachian tubes. You can even take your thumbs underneath the maxillary bone right here, push it up and spread it. You'll feel a little drainage happening, and that can help get rid of that extra sinus congestion. That could be very, very helpful. Now let's get to the ear techniques that can really make a difference. I want you to take your thumbs and put them inside your ears, right where the canal is. Stick it in there and just push it in, then release. Push in, release. You'll hear like a popping sound. Push in, release. Do that about 12 times. Push in, release, push in, release. After doing this about a dozen times, you may feel an immediate change. The sound may be altered. And here's the key thing I want you to remember. If you feel any change at all, you're going to pursue that particular technique. That's how you know it's working for you. Next technique, take your second and third finger and come to the outside of your ear. Put your second finger on the inside of the ear, the third finger on the outside of the ear, and you're just going to rub up against the side of your head. You're going to hear a sound as you do this. Second finger inside the ear, third finger outside the ear. Just rub back and forth as you're against the bone behind the ear. Do that for about 30 seconds, and obviously you're going to do both ears. Now you may notice that your tinnitus is worse in one ear than the other, but it's always good to do both sides. Why? Because many times we can't tell exactly where it's coming from. The brain is picking up this sound, and it's hard for us to distinguish the exact location. Is it one ear, both ears, or the other ear? So always do both sides. Here's another powerful point. There's a main area on the bottom part of the ear called Shen Men. If you take your thumb and second finger and just stimulate this whole bottom part of the earlobe, just back and forth, stimulate it, You can just rub it back and forth like this. Do both ears, obviously. Just go back and forth. Do this for a good 30 to 45 seconds and stimulate this area. This is a good point to stimulate throughout the day. It's very, very effective. This has auricular ear points that go directly from here to the inner ear to the brain, and this is a very stimulating point for tinnitus. Very safe and very, very effective. Now let's take the heel of your hand. Similar to what we did before with our thumbs or our fingers sticking in the ear and letting it go, I want you to cup the ear and push against the whole entire ear. When you push in, hold it about 2 seconds and you'll hear that pop. The whole objective is that pressure gradient change. Hold it in, pull it out, hold it in, pull it out. You'll feel that popping sound. Do that about 15 or 20 times on both ears. After this, you're going to say, wow, that tinnitus seems to be easing up a little bit. That's another great technique you can be doing throughout the day. Now here's something most people don't know. There are times that tinnitus can be caused from the jaw area, specifically the side of the skull called the temporomandibular joint. When you open up your jaw like this, you'll feel an open groove. That's your TMJ area. It's quite commonly seen that the masseter muscles, that thick muscle along the sides of the face, can be contracted. And it's a good idea to take your thumbs, and you can even use a little bit of emollient oil or lotion if you want. Take your thumb and push up against that masseter muscle up and down like this. You can use a couple fingers if you want to do it this way. Really dig in there pretty deep and release those masseter muscles on both sides. They're going to be tender. How do you know you're getting on the masseter muscles? If you clench your teeth, you're going to feel those thick muscles stick out on the sides of your facial area. Clench your teeth and push your fingers in. Clench again. Those are the muscles, the really big muscles. Those muscles can tug at the jaw area. You may have noticed that when you chew, your jaw may deviate. You may have some pain in your jaw. Maybe you had a tooth extracted, or maybe you're wearing braces and your bite is off. That can cause involvement of the jaw. Even if you don't have pain in the jaw, it's still safe to stimulate and break down these muscles. You can do that for about a minute. That could be extremely helpful, and it may be a miracle worker for you. Here's another technique that's been quite effective for many people, particularly if you're a chronic tinnitus sufferer. Take your second finger on both hands and put it on top of your third finger. Come right to the base of the skull where it meets the neck, but I want your fingers kind of right in the back of the skull. You're going to do this tapping mechanism. Your second finger is coming off your third finger, tapping right below it. As you're tapping, you can go back and forth. This is a good technique to do for a couple of minutes. This can stimulate the occipital region, stimulate nerves going back to the brain, back to the inner ear. You can get a lot of good neurosensory stimulation that can potentially cause changes in the inner ear or to the brain, that auditory cortex within the brain, and hopefully that can do some healing for you. This is something you can do a couple times a day, and hopefully it'll be very helpful. Now let me share something really important with you. The transmission of impulses through the auditory nerve from the inner ear makes its way to the auditory cortex. That's where everything starts to work within your brain. That's how you hear. That's how things happen, and it's located in the temporal area on both sides of our skull. I found it very effective to take our second and third digits just like this and just tap just like this. Just tapping, tapping, tapping. Very, very effective. I call this tapotement or tapping, just stimulating this area. It's kind of like something that hasn't been moving or working, and just as you stimulate it, you get more blood flow, more nerve changes, more stimulation back to the brain. Obviously, this is covering over the auditory cortex. This is a really, really effective technique. You probably won't see anyone else doing this, but believe it or not, just the location of where it's at and what's involved inside of it can be tremendously helpful in reducing or even limiting that tinnitus you're having. Just stimulate it. You don't have to go too hard, just tap. You'll hear the sound, and when you're done, you'll feel what we call hyperemia. Hyperemia is increased blood circulation. Whenever something's not functioning or working, it doesn't matter if it's the brain or a joint, by just stimulating the area to increase function, you're going to increase healing. And that's our goal. Now, let's talk about the nutritional side of things, because this is just as important as the physical techniques. Inside the inner ear cells, when there are toxins or damage done to that area, there's excessive glutamate. And in the brain, there's excessive glutamate when we're stimulated, when we have this sympathetic response, when our cortisol and adrenaline are being secreted, when we're all stressed out, when we're anxious, when we just can't relax, when we're not getting enough sleep. Too much glutamate. We have to offset the glutamate. How do we do that? GABA, gamma-aminobutyric acid, has been known to offset glutamate, as well as L-theanine and taurine. Taurine is an amino acid that can offset glutamate in the brain, working like GABA. Other things you can take to supplement. Zinc has been very effective because zinc is known to inhibit glutamate. Omega-3s are extremely important. Everyone should have them, particularly with tinnitus. Vitamin C, ginger, coenzyme Q10, valerian, vitamin B6 with vitamin B12, as well as magnesium. And there are other great herbs like chamomile tea, decaf green tea, valerian root tea, lavender tea, lemon balm, passion flower, ashwagandha. All of these are helpful to wind down your central nervous system. And if there's one thing you should keep away from, it's MSG, because that has glutamate in it. And if you're eating poorly, lots of sugars, really bad saturated fats, you're not eating healthy, you're stressed out, you're not exercising, you're not getting enough sleep, all of those things will contribute to tinnitus and make it much, much worse. So listen, I know a lot was said here today, but I hope you can take many of these things and use them accordingly to help you, your loved ones, your friends. This is very simple, very easy to use information, and I really hope it'll make big changes for you and your loved ones. If you found this helpful, please leave your comments below. Let me know which technique worked best for you. And most important, make it a great day. I'm Dr. Alan Mandell from your Health Circle.